Hello, today we're going to talk about anticoagulants. The two we're going to discuss are Coumadin, also known as warfarin, which is a vitamin K antagonist, and rivaroxaban, also known as Xarelto, which is a factor XA inhibitor. We're going to talk about those in relation to atrial fibrillation. Atrial fibrillation is an arrhythmia that presents with extremely rapid and disorganized atrial activity, resulting in an irregular pulse at 120 to 180 beats per minute. AFib is associated with organic heart disease, acute pulmonary embolus, pulmonary hypertension, or pulmonale, as well as other processes. A common and effective treatment of chronic non-valvular atrial fibrillation is anticoagulant therapy to prevent clot formation, which puts you at high risk for a thrombotic event such as stroke. Compare and contrast of the two's mode of action, Coumadin works against or antagonizes the cofactor functions of vitamin K. Those clotting factors include 2, 7, 9, and 10 that require vitamin K as a cofactor in order to synthesize in the liver. The results are diminished activity in the production of clotting factors. Warfarin does not diffuse into cerebrospinal fluid, urine, or breast milk, but does cross the placental barrier and has a half-life of approximately 40 hours. Whereas rivaroxaban is an oral inhibitor of the clotting factor XA, and it binds itself to the active site and prevents it from converting prothrombin into thrombin. About 1/3 of rivaroxaban is excreted unchanged in the urine. Based on the pharmacological activity of factor XA inhibitors and the potential to cross the placenta, bleeding may occur at any site in the fetus and or neonate. It has also been detected in human milk. Drug interactions. With all anticoagulant therapy, there is an increased risk of bleeding with concurrent use of anticoagulants and antiplatelet agents, heparin, fibrinolytic therapy, and chronic use of NSAIDs. I have provided you with a list of specific medications that inhibit or stimulate these two specific medications. Safety with anticoagulation therapy requires frequent assessment for signs and symptoms of bleeding, as well as teaching patient and caregivers signs and symptoms of bleeding to report, assessment of liver function and kidney function and active bleeding prior to anticoagulation therapy, and report anticoagulation therapy to your physician or dentist prior to any surgical procedures. Spinal or epidural hematomas are a concern for patients receiving anticoagulation therapy that receive any spinal procedures or surgery. Premature discontinuation of anticoagulation therapy increases the risk of thrombotic events. When you change from one drug to another within the class, you will require a tapering off by your physician while you start the new medication. The dosing will be required by your physician. Efficacy and cost. There are lower rates reported of intracranial hemorrhage and mortality with Xarelto versus warfarin, but there are higher rates of GI bleeds with Xarelto versus warfarin. There have been no significant noted rates of stroke prevention between the two, and more research is needed in this area. Cost. Local cost of Coumadin is $9.06 for 5 milligram tabs for a 30-day supply. Cost of rivaroxaban is $437 for 20 milligram tabs for a 30-day supply. Expected outcomes for all anticoagulant therapy related to AFib is, of course, prevention of blood clots and subsequent strokes. Specific outcomes for the two medications include: the goal of warfarin therapy is an INR of 2 to 3 for most indications and 2.5 to 3.5 targeted for some mechanical valves and other indications. There's a narrow therapeutic index, so it requires frequent monitoring to ensure optimal range is maintained. Effective anticoagulant therapy is achieved within 5 days of initiation of therapy with Coumadin. Whereas rivaroxaban, the goal is predictable blood thinning effect, and thus no monitoring of INR or other coagulation test is needed, and every patient takes the same dose, and it's 20 milligrams once a day with food for long-term prevention of blood clots. Also, effective anticoagulant therapy will be achieved within 4 hours of initiation of this therapy, and improvement in patient compliance and satisfaction with anticoagulant therapy is seen with the rivaroxaban. Thank you.